So it's 3 p.m. sharp. So we can officially start. So, dear guests, welcome to the Ready for Future panel session, and we're delighted to welcome you on the occasion of Croatian Kick Off event of Great International Female Accelerator program, where we will also showcase to you the best practices of female digital health entrepreneurs in Croatia. The digital transformation leads to changes in almost every organization, and many new challenges and opportunities definitely arise, but only for companies which know how and how fast they need to adapt. Many companies today are feeling very comfortable with new technologies, trust data and their analysis, utilize AI solutions, and are willing definitely to invest into innovative cooperations to enlarge their success. But today we will talk about stronger female engagement in this field, together with our partners, with great board members, with industry experts, and leading international experts in digital health and life sciences. My name is Anita Galic, and I'm a founder and CEO of Health Hub, a think tank that is co-organizing this event. And I will lead you through today's session. So hopefully you are ready for the future. Let me allow to introduce our today's amazing speakers. So I do not have any doubts that our speakers for today are ready for the future, and let's welcome them. First of all, we welcome DIANE NEVIN. Hi, DIANE. She's the CEO of Startup Program, Director of Great International Female Accelerator. Then today we have Hrvoje Belani, a GREAT's advisory board member, head of sector of information systems implementation and improvement at Directorate of eHealth at the Croatian Ministry of Health. So very long the title, but Hrvoje is really a musketeer of digital healthcare in Croatia. Hi, Hrvoje, welcome. Then we have Milka Kosanovic. She is amazing and very engaged female, I would say, ambassador, and she's the director of membership affairs at the Croatian Employers Association. And she is especially engaged with the healthcare industry and pharmaceuticals. Hi, Milka, welcome. Today with us, we have Dunja Sharif. She's the marketing director at Salveo CEE Group, one of the masterminds of My Pharma Space platform. She will showcase to us later on. Welcome, Dunja. Then we have Katarina Zlopasha. She's the partner sales specialist at Cisco, global IT company, and she definitely is, I would say, one of my dearest partners and co-workers as a Health Hub technology partner. So Katarina, welcome. And to last but definitely not the least, or Maja Jurčević, Adiva program coordinator. This is an innovative comprehensive platform by Phoenix Pharmacia, which is a member of Phoenix Group. Welcome, Maja. And Nina Šesto, she's a digital health director at Magdalena Clinic for cardiovascular medicine. And she will represent Maggie virtual assistant and other digital solutions from the Magdalena Clinic. And she's representing Crow AI Association and AI for Health Crow, which is a consortium that is a candidate for European Digital Innovation Hub. So really a remarkable, I would say, speakers for today. And I hope all of you who are today with us will find their inspiration among these amazing speakers. So some of the studies and results, and many of them are really available regarding digital healthcare, entrepreneurship, and female enrollment, actually believe that in 10+ years for the tech industry, we can expect to be, I would say, to have gender equality in terms of gender, definitely, which is very long period, I would say. So how can we help women to develop the hard skills, the soft skills, and entrepreneurial skills in this progressive field, which are necessary to become the future healthcare digital leaders? There is no better person to hear it from a visionary who is behind the GRIDS International program for female entrepreneurs. And she will tell us more about the mission to enable female entrepreneurs within the digital health and life science with the confidence and skills required to scale a global business. So Diane, the floor or the virtual stage is yours.
Thank you, Anita. Greatly appreciated. And I have to say, I am blown away with the experience and the speakers that are here today. Thank you so much. And I'm looking forward to hearing your discussions and being part of that panel discussion also. So I'd just like to give a quick introduction, I guess, to myself firstly. I'm CEO and Program Director of the GRIT International Program. I come from 20 years experience in business and eHealth consultancy, and my passion really is very much based around female entrepreneurship. So I'll just go on to provide just an overview of who we are. So GDT Health Network, we're a global digital technologies network, and we're for a non-for-profit membership organisation registered in Ireland. And we provide a global network for digital health and life science to collaborate with industry, academia and public sector organisations. So we really aim to develop this and to recur this really around in-person events, education, and the Accelerator program that I'm here to discuss today. Okay, so we're discussing the Female International Accelerator program. So we aim to enable female entrepreneurs operating in digital health and life science with the collaboration and confidence required to scale their individual business. So the passion really came from this is that we're a very established board of over 9 countries. And our passion really is around that, to improve that diversity metric, which is really important around female entrepreneurship and diversity, is why we looked into the program. My own experience and my own passion is I have worked with female startups over the last 10 years across a range of industries, but I've also lectured over the last 7 years in a university around digital transformation. And my experience also is I'm a founding board member of eHealth Ireland here in the HSC in Ireland. And the areas in terms of the lacking of confidence or the skills or the ability around women in healthcare was something extremely important to us. So this is where we started to look at this particular program of how we're actually going to enable women to go on to raise funding, to build up the confidence, because unfortunately, there are many challenges for women when they're trying to raise investment, certainly around working in markets outside their remit, really, as opposed to diverse male-orientated teams that works out quite well in terms of funding compared to females. So that's something really important for us. And I guess as a co-founder and a founder of the program and CEO, is something that I'm extremely passionate around, that we've developed a program that will certainly fit and enable females to go on. So I'll just give you an overview of the program. So we're looking, I guess, at the first modules, and one we start off really to look at is leadership. And leadership is really crucially important for us to work with all the females that enter into the program around leadership, transition, influence, and impact. So how will you influence, we say, an investor to actually invest in you as an organization? How will you have an impact to grow a global team, to go on and be the leader? So it's very much about taking an evaluation of what type of a leader are you currently and who do you aspire to be. We then look at product market fit frameworks, which is really crucial around your market adoption, gap analysis. So any sort of benchmarking to put together a really strong framework. Again, everything that we look at is very much raised around building a framework and a policy for females at the end of the program to perhaps look for investment either over the next 6 to 18 months. That's really the objective for us. We want to look at, help females look at how do you going to operate outside your own home market, which is crucial, looking at emerging markets, competition. So that can vary in terms of legality, legal type of areas. It could also look at language barriers, how are you going to build up and manage a global team? They're all the areas that we look at, and again, policy, etc. Another key area that we look at is digital issues and the ethical issues in digital governance, a big area around due diligence. So a lot of startups, they're very much developed and framed in the actual product or the customers, which is really equally important. But one area they seem to lack at particular points is the due diligence in terms of, who's on their board, for example, how established is their board? Is it diverse enough? Do they have enough policies, frameworks in all in policy? And that area is always lacking, and it's picked up in investment because you're asking an investor to trust you as a startup to give you funding, but the trust really there and the due diligence is lacking. Another area that is really, really important for us is data access, data reuse and ethical concerns. So a big area around investors also is that they want to be able to see that startup organizations have built an ethical framework. So for example, if an organization is currently using data and they're reviewing it and they're working within it, are they using it currently for how it was first originally generated? And if not, there's a legal obligation, but there's also an ethical obligation. And investors are expecting at this point that when you pitch that you've built an ethical framework, because we're working with data and digital health on a daily basis, and we really have to have the diligence around it and the ethical issues. And the other areas that we look at again is cybersecurity, and we have our own expert here, Hervé, which we're delighted to have a conversation with shortly. But again, around, so how are you going to protect all of that data? And how will we build a culture and a framework within the healthcare model for protecting that area? We look at AI, regulations, ethics, healthcare usage. So at the moment, there's current policy being written in by Europe around regulations and ethics, which is really important, and we have to abide by this. So we look at this within the program. How does a female operate within these new frameworks and these new policies? We have it down as a module for raising investment, but I just like to note is that raising investment is something conscious that we do throughout the whole program. Is that how do we evaluate, how do you create the best pitch deck? What is a term sheet? We also have venture capitalists within the program, teaching on the program, females that have gone on to raise investment as part of a panel workshop to say, the do's and don'ts for a female to raise a particular funding, which is really important, and mentorship. So mentorship is a really big key area because I'm absolutely privileged and delighted with all the support we're getting from a global mentorship side of things, that we can align female participants around their requirements and around their needs, really aligned with experts that will help them work out whatever it be around their policy, regulation, frameworks, building the company, building the team, whatever in terms of the requirements that's needed. The program structure is just an overview here for the moment. It's 10 weeks online, but it's quite an intense course. So we have it as GMT, so that would be from 6:30 to 8 p.m. within Croatia. So for the particular areas that, for example, if we look at cybersecurity or AI or ethics or any of that, we cover them in terms of a program, a lecture type of material of high level content and a discussion. And in the workshop, we allow all the females from an international point of view to work together on their ideas, on their frameworks, have an interactive discussion, very much a practical workshop. And then we're very privileged after a short break to have some of our partners, such as Roche, IBM, Microsoft, come in and support that. So you get an opportunity to discuss with our partners your own policy, your own company, what is it that they can do to support you, because as, again, partners, they're extremely passionate to help around that diversity improvement and improving that metric. So that's something really important to us. At the start, just as an overview, is that we're open, the applications is open. It's closing on the 21st of February. That's why I'm so delighted to have the opportunity to talk about the programme here today with you. And the programme doesn't start until the 22nd of March. So there is an evaluation process as an overview, and I and other board members evaluate the applications, and I'm delighted to say that Hervé will also help us to evaluate those applications to see the best females. And something that I would really like to point out also is that it is a very intensive course, and we hope to lead it on to the mentorship afterwards and to build up, because we really feel passionately enough that when women finish the programme and complete the programme, they will have built a network of an international network. They'll understand how to operate outside their home market. They'll have built a really strong framework and business policy to go on for investment, and all the ongoing support that will be after the programme. The one thing that we would ask for is the commitment, because female founders, they're extremely busy. And if it's something that you may only be able to look at one workshop or two workshops, or you may not be able to, you're not really going to get the best out of this program. And it will take up a place for perhaps another female that would be available for all of the sessions. So I would just ask females to be conscious of that, take that really on board, that it is a great program. See, can you commit throughout the program? A little bit around who should apply. We really want to work with female startups and diverse teams that are operating in digital health and life science. So again, you're part of a female diverse team, perhaps you're a co-founder, you have an idea, you're working within this particular area. It's either a technology or a service. And again, it can positively impact digital health and life science. Some proof of concept. So again, you have a functional prototype. For us, you know, some accelerators say you have to be a year, or we want somebody with 2 years. We feel that because you're working in life science and there may have been a lot of research beforehand, it doesn't really it's not about funding, it's not about how much you've raised, but it's the potential for how much do you want to go on to raise. It's the potential for what you want, or you have some sort of a prototype, you're working within some sort of organizational structure. And again, you're a full-time founder, that it isn't just a case that you're very, very early on. We want you to develop within the program also. And again, any female founder that's based in the UK or the EU can apply for this program. And we'll evaluate it again, as I said, in terms of the submission process. We look at market traction, growth potential. So how, you know, in terms of how are you going to grow, how are you going to scale, your team strength and founder diversity. So that's a really important area, that the founder diversity again is a key area for us. How to apply. The website, I'll pop it into the chat also, or you can apply through F6S or Google Forms. You can also contact us, and you know, again, we have Hervé, and this based in Croatia, an amazing guy in terms of all his support as a board member. You can reach out to Hervé or myself or Anita, and another amazing support through the Health Hub. So we're all here to take any of your questions in terms of the program, etc. So just wanted, it's a short overview of the program, but it's just really as a remit to open up a dialogue and have a conversation. I just want to thank Anita personally for hosting this and partnering us up with this session. I think from my end, it's always amazing to meet a female that's equally as passionate around female leadership and diversity as Anita is. So thank you so much. I really appreciate that. And I'm looking forward to all of the speakers here today and our board member Hervé. Thank you so much.
Anita, you are on mute.
Muted. So thank you, Diane, for diving into the whole mission and vision of the GREAT program and the inspirational insights. And all of you and participants, panelists, and attendees, feel free to check out later on the GREAT's website immediately after this event, and see the possibility to be enrolled into this amazing program. So our next speaker is, as I said previously, the musketeer of digital health. And I would say, despite of healthy demand for digital talent, the lack of diversity in tech continues actually to be quite pervasive. According to some studies, the women constitute 36% of university graduates in the science, technology, engineering, and math, so in STEM field, but they're represented only by 25% of the STEM workforce. So many might agree that especially the high-tech industry compared to other industries actually lacks gender diversity in executive positions. Our next speaker is really recognized not only as the ambassador of digital health, but he has more than 18 years of experience of working in IT sector and in academic research and teaching, and which is, I would say, quite important to become an advocate for this mission is that he finished the Academy for Political Development of the Council of Europe, the UN Academy, and Harvard Kennedy School Executive Education. And now, as I mentioned, he's the head of sector for information systems, implementation and improvement at Directorate of eHealth at the Ministry of Health. So there is no better perspective than a male perspective of why we need more women in digital healthcare and why we decided to serve, why he decided to serve as advisory board member for GRIT. So let's welcome Hrvoje Belani. Hrvoje, the stage is yours.
Thank you, Anita. Thank you very much for this wonderful introduction. And thank you, Diane, for your great overview of the whole GRIT program we are preparing and offering to the public. And please allow me to say it's my pleasure to be here today. And of course, to volunteer as advisory team member for the GRIT program, as well as to contribute as industry expert and course leader in the program. I will go briefly in one of the topics I would like to focus on, but first, of course, just a few more words about me. I come from the software engineering background. I majored in telecommunications and informatics here in Zagreb. I work in eHealth for more than 10 years, and very actively in national and EU programs and projects. And the touch point on cybersecurity is that I'm engaged in the EU Agency for Cybersecurity expert group on eHealth security, so ENISA's expert group in eHealth security. I also serve as a eHealth network representative for Croatia. That's been very, very dynamic in the last 2 years with COVID going on. And I have some academic background also, which helps me to provide the overview of the topics, not only from the technical perspective, but also, I hope, from pedagogical perspective. So why cybersecurity? We are all aware that we live in a broadly connected world, so devices we use, the sensors we wear, the actions we do on the systems we interact with, the cars we drive, it's all, everything is actually posing cybersecurity risk in one sense or another. So there are vulnerabilities that we have to be aware of. Of course, it doesn't have to be a showstopper for using digital technologies, but to comprehensively approach to the usage of technology and to address the risks appropriately and in a timely manner. Of course, cybersecurity in healthcare is also one broad topic that is being addressed for years because the challenges are present there also. And of course, there are many areas, many other areas where cybersecurity should be addressed. But if we go into more deeper in the question why cybersecurity in healthcare, we can check just few recent assessments and reports. So the one from Europol says that the ransomware that have been threatening the digital or cyberspace globally actually becomes more and more focused and human operated towards private companies and toward healthcare and educational sectors, and of course critical infrastructure and governmental institutions. So you can see that healthcare is pointed out as one of the high targeted areas, but also if we say critical infrastructure, also we can find healthcare systems there, and of course government related systems dealing with healthcare. So we can actually see that healthcare will be touched and is touched by cybersecurity threats in any way. So if you look at another report, so this is a really relevant cost of a data breach report from last year from Poneman Institute. We can see that healthcare is the #1 industry when it comes to the average cost of data breach. So for 11 years 11 years so far, it has been like that. So there are some industries that are actually in this report showing decrease in the average cost of data breach, but healthcare keeps growing up. So we can see that there are more and more challenges we have to deal with and tackle if we want to provide digital solutions, digital tools to the broad users. So why GREET? Personally, Diane said introduced the whole program and gave the overview. But personally, I really think this is the very fresh and unique educational program and a huge change for female entrepreneurs. I think it makes really a difference that it asks for no participation cost and no equity taken in this for this program. So it's really something that adds a value to the let's say to the accelerators ecosystem around Europe. And of course, the program aims to really offer contemporary insight. You have the combination of soft skills and, of course, let's call them hard skills or technical skills in dealing with healthcare and delivering healthcare-related and life science-related products and services. What I would be addressing during the program will be cybersecurity and asset protection for startups. Of course, we will cover the basics there. What does it mean, cybersecurity and asset protection? But for startups, we'll try to focus more in that context. But we will also provide some in-depth approach. What are the best practices? How to protect startups and enterprise resources in that sense? We will look into some known vulnerabilities, threats, and risks. Some solutions that came along with those, and of course we will look at different technologies from web to mobile, from IoT to AI, and see how what should the proper approach be to establish protection and resilience. Of course, as we're all aware, one of the weakest links are humans. Nevertheless, if it's an inside intruder or outside bad guy, let's say. So everything has to be done that cybersecurity awareness should be present in the enterprise, in the startup surrounding. Cybersecurity culture should be established and maintained, and something we called also information security hygiene. So there are many regulatory things that we would like to also address and to provide some hints, provide some advice in that sense. How should startups and small enterprises actually approach this pretty broad area? In terms of structure, this course will be consisted of 2-day lectures, as Diane already mentioned, Tuesday, Thursday lectures in the evening, and the 2-hour workshop on cyber attacks and cybersecurity best practices. So if I just go briefly on the structure during the days, this is the working version. I think it will not change much for the final version. So 2 days of lectures, so 90 minutes each day from 6:30 to 8 p.m. And then for the last day, for the Saturday, we will go deep more. We will go deeply into the practical sense and see about the attacks, comment about the approaches that are known, the things we can do to actually protect our assets, and what references we can use to help us with in doing that. And of course, this is the cybersecurity masterclass also as additional value of each of such courses in GREET program that will be delivered by a core partner, one of the core partners here. So this is briefly from my side. Hopefully, I got you the little bit of sense what the cybersecurity course will look like, and hopefully many of you will join us in GREET Accelerator program. Thank you.
Thank you, Hervé, for amazing insights as always. And you really, I would say, prepared the inspiration field for our upcoming amazing panelists. So just to give maybe a short intro for the panel session with our beautiful and intelligent guests. I have to quote the European Commission's dedication and agenda that more women in the digital sector was mentioned as a key to Europe's successful digital future. And the European Commission is planning to do this by focusing on three areas. One of them is definitely to combat gender stereotypes and promote role models. Our panelists are definitely serving as amazing role models. Then to enable, encourage, and motivate girls to learn digital skills and take up STEM courses, STEM subjects. And the third one was to enable and encourage more women to participate in digital entrepreneurship and innovation. So this is something which is, I would say, in the core of the whole GRID program and today's virtual event. So our chiming ladies will definitely tell us how they did manage to do that, at least in Croatian ecosystem. So once again, we are welcoming Milka Kosanovic, Dunja Šarif, Katarina Zlopaša, Maja Jurčević, and Nina Šesto. Thank you for accepting our invitation and that you're really true role models and best practice examples of promotion and support of women engagement in digital healthcare industry. So maybe to start first with Milka, as a representative of Croatian Employers Association. Actually, you really timely recognized problems related to women in business. And you have launched your women's database, and you're proud of 100 successful leaders who are the ambassadors of your database and who are ready to take on management positions at any time in any company. You also have participated in survey together with Deloitte about women in business world. And this survey, as you definitely presented, shows that the attitudes and thoughts of 186 women and men who are the managers in leading positions of companies and financial institutions, with special emphasis on the development of women entrepreneurship. So do companies in Croatia nurture gender equality so they can be more successful and competitive in the market? Milka.
Okay, thank you, Anita, for inviting me to take part of this great panel, and my congratulations for your selection of such great lecturers. So regarding your question, yes, the awareness, I would say that the awareness of the need for fair treatment of women in Croatia, in business as well as in the whole society, has advanced. I would say that all the projects, all the conferences, all the public debates, every single education improved that awareness a little more. But there is a small but. There is still a gap, I would say a huge gap, between what is declared and what is the everyday life of regular women in business in Croatia. We have great examples of women at the top of the companies. The CEO of Coca-Cola in Croatia is a woman. PMI as well. The great woman as head of MSD. We all know Rina, a great leader. But there is plenty of other companies where women can take only a role as, and this is the top, as a management board member. So if you ask me what's the reason, mathematically it doesn't stand, because in the European Union, the whole population of the European Union, more than a half, 22% are women. We are more and more educated. We have all the necessary skills. I think, and it's obviously, and all previous research conducted in Croatia showed that. Last one with Deloitte, the company you mentioned and the project you mentioned, showed that there is a gap. There is still a gap. So obviously there has to be something more, and something more is needed to be done, more than just declarations, I would say so. Everybody is here to declare, yes, I am for the gender equality, but tomorrow when you have to implement every single detail of that, well, we have some problems.
I mean, this is really an amazing feedback, and definitely a great, I would say, key takeaway for upcoming dialogues, events, etc. I think our guests today, who really managed to make some innovative solutions, or the best confirmation that we have excellent potential, and that we need to build the story upon that. So maybe as an amazing intro, allow me to share with you something that our next panelists will talk more about. And this is the product of many creative female brains. So let's see the creative results of My Pharma Space team. So this is, for me as a pharmacist, I would say quite impressive digital solution that that really puts our practice into the next level. Dunya, especially in the healthcare industry, digital thinkers and masterminds can really make a big difference. And we saw something that really makes a difference. So whether it's an app that makes healthy living easier, a new medical device or idea that could help streamline the complexity of the healthcare system and healthcare industry, digital leaders are truly the pioneers in this category. How do you and your team feel as digital leaders with your really creative and innovative solution like My Pharma Space is?
Thank you, Anita. Hello to everyone again, and thank you for invitation for this really nice event and useful, definitely useful. Maybe just to have for introduction to answer this question, more information, a bigger picture about My Pharma Space. And My Pharma Space is not just Croatian app. We are present in CE region in 5 countries: Croatia, Serbia, Montenegro, Bosnia, and Poland. Poland from last year, so we're not so big at the moment there. We have more than 11, almost 12,000 users from pharma community. It's around 30% of the pharmacists from each market except Poland, because we started there, so it's really big market, so except them. And yeah, we are doing a really great job, I can say. And to answer your question, you know, when the very common is to compare projects with child and raising the child and with babies. And I think I also decided to go with this, you know. Somehow there are 2 emotions among my colleagues and me. One is definitely proudness, that we are proud on what we achieve, what we create, what we gave as added value. You saw that we create a place for communication, for connecting. This video is from the beginning. We upgrade now, so we are also giving space for education, to sharing knowledge. We develop one part with cases from practice together with universities. So working with students, so we did really great effort to give something more to pharma community. And then on the end, we are very proud of ourselves, because 4 years ago when we started, we did dig to a really unknown field for us. We are a pharmaceutical company, marketing oriented and digital oriented, but you know, to develop application is something totally different than working with digital marketing. So yeah, it could be, you know, poetically says, but really at that time we had just idea and passion. And yeah, and so yeah, this is about proudness. And I have to be honest, so there are other emotions, but to choose the one who is best describing raising the child is also the frustration sometimes. You know, we are giving so much from ourselves, from the resource, time, a lot of energy, love, and then sometimes we have a lot of times we have expectations, and sometimes we don't you know, receive what we expect from the pharma community, this engagement and I don't know. Yes, maybe engagement is the best word, but you know, it's not about application. It's some other topic for the other events. It's about, you know, in everyday work with the pharma community. We are also having the same challenges. So this is not about the app. And yeah, but this, I would say, that help us so much in developing ourselves as a person development, and also as team development. So there is also some positive income from this frustration. Yeah, I think it's basically it.
Dunya and myself, we know each other for a very long time, and we studied together. So I would add that there is one quote that the biggest enemy actually for the disappointment is the high expectations.
Yes.
On the other side, I remember a few years ago while I was in Croatian Pharmaceutical Society, we sat together for a coffee on the sunny terrace and discussed about some innovative idea of developing your application. And in past few years, you managed to build this app on a regional scale, which is quite amazing. And we still have maybe different challenges, but on the other side, if we put our heads together, we can change the horizon perception and get, I would say, the expected feedback from the whole community. So keep going. Maybe every challenge at the same time is an opportunity for growth. And this COVID pandemic definitely is an opportunity for growth. So during the COVID pandemic, digital health and telemedicine solutions really experienced rapid growth. But these are not new concepts, and some healthcare facilities are implementing digital health for years. One of them is Magdalena Clinic, amazing creative institution in Croatia, very proactively engaged, which established the first telemedicine center already in 2000. So Nina, as a digital leader, and I admire your energy, could you tell us more about your experience and results over the years?
Thank you, Anita. It's really a great pleasure to contribute to this panel. So just to give you a little bit of background, Magdalena Clinic is specialized for cardiovascular diseases. And basically the vision and the idea since the foundation of Magdalena was to unite the whole patient journey from non-invasive diagnostics to interventional cardiology, electrophysiology, to basically the most complex cardiac surgery, vascular surgery treatments. So literally, while patient is within the hospital, patient is safe. But what is happening with patients when they leave the hospital? And these are chronic condition, and chronic automatically translates that this needs to be continuously taken care of. So these patients need continuous access to care. And with this vision, basically to bring care to patient home, even when they're not in clinic, we implemented the first telemedicine center already in 2000. And since then, we've been developing several digital health solutions. So in a way to try to keep it simple, I could explain it as a, let's say, a three-layered approach. So first of all, what we did, we digitized, the fundamental thing, let's just digitize interaction between patient and the doctor. So now we have a virtual clinic, we have a platform where patients can basically schedule an appointment, exchange their medical documentation, and connect with the doctor regardless of their geographical location, right? So now, so now we've established this contact on a distance. So now we want to have some data from that patient, so that we can add on the clinical picture of the patient, so we can better tailor the treatment. So this is the core of the telecardiology center we have. So we give patients a 12-channel ECG device that is adapted for patient use. And basically from comfort of their home, they can send their 12-channel ECG, which is a gold standard in the world of cardiovascular diseases. And then we have a center 24/7 where physicians are receiving this data and basically consulting a patient over the phone. And these are the telecardiology consultation. We have 12,000 of these consultations every year. But so we can receive data from patients. We can communicate with patients. But literally the bottleneck of digital health solutions and telemedicine is doctors' time. Because with the growing number of cardiovascular patients, of chronic patients, on this planet, we don't have enough of doctors, we don't have enough of physicians that can then provide this kind of comprehensive care remotely or even offline. So we need to think, how can we scale efficiently these kind of digital health solutions? And this is where basically AI, artificial intelligence, comes into play, because these are tools that have this amazing capacity to automate a lot of those digital processes. So we decided to kind of capture our cardiovascular expertise, capture this knowledge in a form of a digital health assistant, who is just an automatic system, but capture this knowledge. It's available 24/7 to patients, and it can basically speak with thousands and thousands of patients at the same time. So now you have this scale up expansion effect to kind of, you know, increase access to many, many more patients. Overall, I mean, the path that we are taking is not only to connect with the patient, but to empower patient to basically become a proactive partner in the management of their own disease.
That's great, Nina. And the story about Maggie really, I would say, inspired some other very interesting novelties on digital healthcare horizon, e.g., for instance, Andrea virtual assistant during the pandemics, but we will discuss maybe a little more about changing the whole ecosystem in Croatia with new partnerships and consortium. Maybe before the next, I would say, interesting approach for the, again, pharmaceutical community, let's dive a little into the world of Adiva platform to see how they, I would say, change the horizon of pharmaceutical care in Croatia. So Maya, we have seen the Adiva innovative concept, and I remember one of my public health campaigns I was leading for the pregnant women on the self-medication and self-care was 9 years ago, partnered with Adiva, and this is completely new digital approach oriented not only toward the health professionals, but also toward the patients, which is quite important to speak about digital solutions also for the patients. And you have launched this unique platform and business concept for pharmacies in 2010. So how can you evaluate the willingness of pharmacy sector after more than a decade of ADIVA concept? Can you hear
Yes.
us?
Yes. First of all, hello everyone, and thank you for having me today with you on this panel. We started with ADIVA business model 12 years ago, as you said, and we have had two ways of developing the program, B2B to pharmacies and the pharmaceutical industry, and B2C to the end consumers and to the patient of those pharmacies. In the beginning, there was only one B2B and one B2C activity. So therefore, we also developed the program very carefully, step by step, activity per activity, to reach better understanding, proactivity and compliance from the pharmacies, and also to reach certain level of brand awareness. In business-to-business terms, ADIVA should help our members to increase their service and business success. They are provided with a wide range of marketing activities and tools to support the improvement of their pharmacy business. Pharmacy owner or director is responsible for taking care of health of their patients and supplying them with medicines and health products. Alongside their core role as a pharmacist is also to manage a range of business areas, including product and pricing, marketing and communication, stocking and sourcing, recruitment, and at the same time they need to innovate and to differentiate from their competitors. So the need to ease their workload is clear. Entering into a pharmacy partnership such as ADIVA was at that moment necessity for them. But I must confess that it was really a challenging and hardworking path for all stakeholders to reach today's results. And there is still a lot of work to do in place for upgrade and development of the program. The first challenge was to communicate the idea behind goals, key benefits to the small and independent pharmacies and pharmacy chains, of course. And after that, the challenge was also to have the same level of collaboration and compliance from the pharmacies to achieve some recognizable status and attractiveness to the pharmaceutical industry. But after all decade, there is an absolute and even stronger need to continue to promote the pharmaceutical role. The pandemic time showed us more than ever that the pharmacists are really the most accessible healthcare professionals, and the ADIVA program helps them to be closer to their patients.
This is really more than necessary, and thanks to the innovative and I would say the developed modern technology, today we can discuss about some additional services for the pharmacies, but also for the patients. Katarina, there is an interesting quote that is said by Cisco: between envisioning a better world and creating one, there's a bridge. So for over 20 years, Cisco's approach to healthcare has been really empowering organizations to take on new challenges, and the same approach we want to apply today for our attendees who are listening to us. You have placed more than 17,000 healthcare organizations on the cutting edge of technology-enabled care. I would maybe ask two questions in one. First, how do you feel to be a part of this global mission, which became more than ever important during the pandemics? And the second question, what is your role when we talk about reskilling of healthcare staff in digital literacy manner? And how many female accounts do you collaborate with? Do you see stronger role of women in eHealth, or we still need to work on this field?
Hello, everyone. First of all, I would like to thank you for inviting me on this event, and I'm delighted to be a part of this initiative and discussion. Cisco purpose is to power inclusive care for all, and we as a company are committed to the best support for healthcare organizations and reimagine care for the future. When you ask me how I feel very proud, but also responsible to be part of this global mission, which, as you already mentioned, became more important than ever during pandemics. I remember when the pandemic started here in Croatia 2 years ago, most organizations were not ready for it. So our responsibility was to help them with available solutions to transform their business and way of working. So we gave our solutions for free so they can use them in these unpredictable times. So I believe, as Cisco quote says, that technology is bridging the healthcare gap and improving access to wellness for those who might otherwise be excluded. And I'm very glad to be part of this process. Regarding my role, the healthcare industry is changing rapidly, and I believe the goal of any modern healthcare organization is, first of all, personal experience. They need to increase care availability while protecting patients and their data, of course, easy communication and secure sharing of information. So here in Croatia, Cisco has a network of partners with whom we cooperate on different healthcare accounts, offering them solutions that enable the continuous development and expansion of their services and data. So part of my role is education of our partners and healthcare end users about the available solutions we have so they can transform their business. But I need to mention here that improving the digital skills is an important challenge we have to tackle on different user levels. So this is not unique for the health sector. We need a higher level of digital literacy across society as well. So that we have all confidence in using technology, because ideally we will get to a place where digital solutions are not forced upon anyone, but taken up because people find them, first of all, simpler, better, and more effective. So in my work, I work with a lot of women in this field. In IT, we see that there is not a lot of women in IT represented sector, but in healthcare there is a strong woman community, and collaboration with Health Hub is one of the great examples.
Oh, thank you so much. I'm glad to hear that, especially from our ambassador who represents the female leaders that moves the boundaries of healthcare sector. So the image that we have shared is the image from the premiere edition of Health Hub magazine, where Katarina was presented with her vision as somebody who really understands the need to transform. And this is something that GRIT is established for, to help, to support, to transform the whole ecosystem in entrepreneurship for the economy, but also for the benefit of the patients. Milka, you're very engaged in collaboration, of course, with your membership companies at the Croatian Employers Association. To what extent, and you have also seen some examples of what pharma companies or wholesaler companies really developed in Croatia and upscaled it on a regional level. To what extent has the domestic pharmaceutical industry recognized the importance of investing in and connecting pharmaceutical care with digital tools, whether through learning on digital platforms or creating mobile apps for the healthcare professionals and for the patients?
Yes, well, all digital tools, platforms, apps, etc., have become a vivid part of our everyday lives. I mean, we no longer read newspapers at the table. We are scrolling on our way to work, so everything has changed. Besides health is the topic of every average person. Either we are patients or have some issues or just have to be more educated or informed. So there are plenty tools. Pharma sector takes his role in this field and puts a lot. I can say puts a lot on informing and educating people. Education of medical practitioners. I think it was Dunya who mentioned that 30% of all pharmacists in covered countries, I skipped which countries are covered, take the app she developed, as I catched everything correctly. So everything is just similar in domestic, among domestic pharma or pharma companies. So we try to do, I would say, an extra mile in informing and educating either professionals or regular consumers or patients or average person. Yes.
That's great. And maybe Dunya, to build upon Milka's answer, actually share with us what was the motive to develop this innovative solution for the pharma community as a support to their daily work. And maybe the second question, do you consider yourself and your team as a role model for future female digital leaders by sharing your expertise throughout events like this?
So first about the motivation. At the first it was a business, motivation, definitely. We wanted to, you saw what we offer to the market, to the community, really a lot. And we didn't want to have branded application, not branded even with Salveo or our brand. So, but we wanted to have loyal partners in the future. So, and we wanted to differentiate. We are a marketing-oriented company, not sales. So the giving rebates and this kind of activity that usually is in retail was not our way. So this was somehow the way for us. And then very shortly after we started, one very special moment happened. And this is the second motivation. And now it's this altruistic, really, motive from not just from my side, but also from all of the team feels like that. Because, when you feel that you can give impact, you can give footprints, and you can change habits of the students, of the pharmacists, pharma community, then you started to feel your purpose. And when you feel your purpose, this is like a magic, then you can give, and it's not important to receive anything, for that. So this was, I think, for all of us, the special moment. And it's because of the team. We are really happy that we have so nice women. Really, I have to say, it's not because of today's event, but especially not just in Croatia, in Serbia. I think that in 90% are women in the company. I'm not sure about the percentage, but really a high percentage of the women. We have really open-minded team, creative team. But I have to say that the universe also sent us the people that recognized our work, our love, effort, everything we gave and still giving, university chambers, health club, even you, Anita. So thank you also for recognizing. And then, you know, it was somehow easier to share what we do. And yeah, so we are really thankful for all of that happened to us. And about role, it's somehow difficult for me, you know, because for 4 years now I'm giving lectures on for 5th year students on University of Faculty of Pharmacy, University of Zagreb, and on marketing OTC drugs. And together with Mirna, my colleague, we are also preparing workshop for them. So we are really close with them, with their mindset, their attitudes, how they see the future, what they appreciate as values. And I'm not sure that in the future they would need a role model. They're definitely different from our generation. Maybe I'm role model now for them, but for the future, because, you know, about the so changeable times, information, trends, everything is changing. What is relevant now in 1 year, 2 year, 5 year will not be. So I'm not sure that somehow education that I have or knowledge would be relevant, but maybe attitude and consistency and love, passion that I have for my work, this would be something that they would see as example. I hope.
This was quite sincere, and definitely this is a great takeaway that the new generations are adopting, I would say, naturally to new technologies. And maybe Nina is the one that definitely, as somebody who is quite young and went into the startup scene, can share with us. Nina, how do you see the business and clinical potential of digital solutions you have developed in Magdalena? And on the other side, how much Croatia can play with the best players on a global scale when we are talking about e-health ecosystem? I mean, you're a part of the consortia named AI for Health, CRO, which gathers all the stakeholders to speak about the artificial intelligence that you're utilizing in your clinic. How much this can be, I would say, changed with the young people, with the new workforce, and on the other side, how your experience can serve as a role model?
Well, I think, I mean, what healthcare systems and governments, I would say, are facing is just the increasing number of chronic patients. The human lifespan increased tremendously over the past 50 years, and our lifestyle is changing. So already now, healthcare systems are overburdened, and we all experience that, not only in Croatia, but across the European Union. We are very much limited with the capacity of our healthcare systems in general. So digital health and advanced technologies have been perceived over the years as something that can help us increase this capacity and increase access to health. And I would say, I mean, clinicians and people are speaking already about digital health for at least 10, 15, if not 20 years. However, implementing innovative digital health solutions often means not only having skilled and educated workforce in IT segment, but also this type of solutions very often interrupt already established clinical processes that are often quite rigid. So, you know, there have been quite a lot of initiatives over the past years and, you know, trying to break into significantly in the healthcare industry. And it was quite difficult, I think. But with the pandemic, as you said at the beginning, you know, the silver lining of pandemic is that we were just confronted with a situation that was completely new to everyone, when suddenly digital health and telemedicine was not something that is nice to have or something, you know, that is a future of medicine that will happen in 5 years or 10 years. But suddenly, over the night, telemedicine and digital health became, in many cases, the only tool to interact with the patients. And then suddenly, like, the whole market just woke up and everybody realized, look, well, this is working and it's not so difficult to implement. And actually, you know, sometimes it's even more beneficial than the, let's say, offline analogous process. So, you know, these technologies have been always out there, but what changed is the adoption of those technologies accelerated tremendously. And this is driven primarily with the fact that there was this momentum of behavioral change that happened on both sides, both patients and clinicians. So now we are talking about the market that is exploding. There are a lot of investments. I mean, over the past 2 years, the investments in digital startups exploded completely. So I think, I mean, these are great opportunities. And this is a great opportunity for Croatia as a country, because we have this very, you know, very much comprehensive European healthcare system. And at the same time, we have a fantastic IT industry, you know, with the superstars in the IT sector and, you know, all the innovative technologies. So, you know, in this kind of market, what we need to think now is how to bring those two worlds together. Because what very often happens in this digital health space, I would say, is that a lot of technologies is developed and a lot of resources, you know, both researchers and, you know, innovators and startup companies, they put a lot of resource to develop a product. And then this product comes into hands of clinicians way too late. So that too late, they realize, okay, this is something that totally doesn't fit the workflow, or it's not even answering the right question, it's not solving the right problem even. So what we need to do is bring those two worlds together so that early on, researchers and innovators have access to clinicians, have access to patients, that they can early on test their innovative solutions. And I mean, I would also say co-develop solutions together with the clinician. And this is like the overarching idea of the AI for Health Hub that we launched.
Please save your thought for a final wrap up, because I think that with AI for Health, you're doing amazing job, and throughout other initiatives with Crow AI and Magdalena. Maybe Maya, for the sake of time, we have to finish until 4:30. Maya, how does the innovative platform like Adiva really changes the perception of wholesaling pharma companies? So far, they were perceived only like distributors from point A to point B in healthcare surrounding. And now you're offering something that completely removes the boundaries and improves the lives of the patients that are at home and have access to health informations.
Yes, we believe Adiva changed the perception of Phoenix as a wholesaler a lot within the pharma industry and healthcare system. The reason for that is because through Adiva business concept, we provide tailored solution for the pharmacies and especially for the independent pharmacies, small pharmacy chains, and we want to strengthen them to compete on playing field at the same level like large and bigger chains. So yeah, in that sense, we strengthen them on the market to the pharma industry and also to their patients. And Phoenix changed a lot of time ago its image and position on the market, bringing that added value and additional services and competitive advantages with customers and clients. And it's not only a pharmaceutical wholesaler, but a healthcare provider who connects pharmaceutical industry, pharmacies, wholesalers, and their patients.
Thank you, Maya. maybe taking into consideration the time, I would invite all of you, but first Katarina and Milka, to give a short wrap up in 2 sentences, maybe focused on how can we ensure that we have more and more female digital leaders in Croatia to somehow to support this whole concept on GRID's mission. Katarina, Milka, and then the other panelists for the end.
So I believe that all of us have some responsibility to share our knowledge to others and encourage other ladies to do something they are thinking they are the best. And from my perspective, from Cisco company, I believe that we will continue to be a trusted technology partner in healthcare, delivering a portfolio of solutions that securely connects providers, patients, and staff to move healthcare technology forward in times of change. Because now it's more than ever, we believe that technology can be used to provide an opportunity for all, make a meaningful impact, and bring about a future that is better and brighter than today. And we as women have a strong power to be part of this process.
Very strong statement. Thank you. Milka?
Yes, I think the main obstacle for women to take more and more in this market is sort of biases and stereotypes which discourage them or do not attract them to this field. So I think that we all have to be small agent of changes to accelerate changes. So we have to encourage every woman to take part in this market, and every good career, every good job in this market is just something that we have to support, and more women will take part in digital as well. So the mindset is changing of mindset is a must, and we all have to be a part of this, starting from us here today.
Fingers crossed to that. Dunja?
I decided to share the quote, one quote. It's somehow connected with women because it's from Ellen Johnson. She was the first elected female head of state in Africa. And also the quote somehow motivate us along our way, creating My Pharma space. And this is a leadership event. So somehow some leadership quote. And the quote is that if your dreams are not scared you, they are not big enough. So we are women somehow in front of the men with this dreaming. I'm sure. So let's dream more, and the success will come. Yeah.
And do not afraid to be scared by your dreams, right?
No.
Maybe can we check with Hrvoje? Is he scared of all those strong female dreams as the only male speaker today? Short one sentence, Hrvoje.
Yeah, thank you. So I think we are already aware of some great initiatives within the country supporting women in technology and engineering. I know Women in Engineering Affinity Group with IEEE. I know there is a project in Women in Technology by Digital Health Association, and many other projects and initiatives, including Health Hub, of course, led by female, and the AI for Health.cro, also one great initiative and consortium managed by a group of ladies. So I think there are many competent females within the area, within the industry. There is so if we look from the policy maker perspective, there are some other challenges why we cannot, or why there are not so many experts coming into the Ministry of Health, for example, working, because there is always check and balance and payment challenge. So it's not very, it's always challenging for people to work within the government if they can get a better paid job outside of the government, in private businesses. But anyway, hopefully we can network all and bring additional value through the networks like this.
Great, Hrvoje, thanks. One sentence, Nina and Maya, and at the end, for a close-up, we will hear our co-host, DIANE. Nina?
Okay, I'll be very short. I'll just say empathy. This is something that we are very strong at as women, and we definitely need more empathy in healthcare. And we can use the technology to really empower patients to transform from passive bystanders to active participants in the management of their health.
That's amazing. I will definitely take this as a key takeaway, empathy. Maya?
Yeah, great. I agree with Nina. This is really nice. But also, I will just add on the end, maybe just to be brave and to share our experiences and knowledge, and to take other experiences and knowledge, not just from other countries, also from other industry, if it's applicable to our area, and just to go on.
Mm-hmm, definitely. We will write this down in conclusions. DIANE, short wrap up before the closure.
Sure. I just want to say, firstly, again, thank you so much. I've really enjoyed the conversation. It's really engaging. And I've taken lots of notes, jotted different comments that has resonated with me. But one thing Milka has mentioned in terms of, you know, that from a society across every country, we like to look at a statistic and say we're improving this and we're improving gender. However, when we look at it from a personal experiences, she said the gap in everyday leadership, it's not the experience that every female feels. And I think in order to improve that, we have to keep the conversation open. We have to build a network and a support to help women. And I often have the note getting ready for females, getting ready to take the seat of a board position. And it has to be an area of going for growth continuously.
Mm-hmm. Thank you, DIANE, for really inspirational takeaway. And for all of you, feel free to check out the GRIT's International Female Accelerator program. Go to their website and feel free to approach the Health Hub. We will connect you with all those amazing speakers. Big thanks at the end of this event to our all panelists and speakers and our partners, GRIT, Croatian Employers Association, Cisco, Salveo Group, Phoenix Pharmacia, Crow AI, AI for Health, Croatian Healthcare Employees Association, and Croatian Chamber of Economy. Without their support and mission, this event wouldn't be successful. So at the end, there is one amazing bestseller that, among other great books, really changed my life and was a huge part of inspiration for Health Hub. It is called actually The Grit. So I'm sharing this with you, and this New York Times bestseller from the pioneering psychologist Angela Duckworth shows anyone striving to succeed that the secret to outstanding achievement is not talent, but a special blend of passion at one side and persistence, and that compounding is called grit. So dear all, have a great day. Do not hesitate to work for your dreams and definitely stay grit. So until next time, bye to all.
Thank you. Bye, guys. Thank you.
Thanks, Anita.
Thank you. Bye.
Bye.